Welcome to Table Talk, and thank you for joining us today. Today's guest is Dr. Lichaa from Ascension Saint Thomas to talk to us about Heart Month. Welcome to the show, Dr. Lichaa.
Thank you. I'm honored by your invitation.
Well, we love having doctors on here to give us lots of information. The older we get, the more we care about our bodies and what's going on. And I love that February is Heart Month. So that you're a specialist in that. I just want you first, though, to introduce yourself and tell us, the audience, about yourself.
All right. So my name is Hady Lichaa. I'm an interventional cardiovascular specialist. I do both heart and vascular interventions. I have trained in New Jersey, did all my internal medicine, cardiovascular, and interventional cardiovascular training in New Jersey. I've been in practice for about 11 years now, and I practice at Saint Thomas Heart in Murfreesboro and Nashville. I do, again, both heart and vascular interventions.
What got you interested in vascular medicine?
So I see the entire cardiovascular system as a unit. Having just focus on the heart without the vascular system is not. It's a much more comprehensive approach to a patient to understand the entire plaque burden that invades the heart and the vascular system, and being able to fix both is something that I was very interested in. And it has its own satisfaction, its own reward, saving limbs, saving organs like kidneys, brain, stroke, etc. All of these are very rewarding from a clinical standpoint.
Yeah, so you're not just taking care of the heart, but you're keeping the blood pumping to the
Yes,
other
ma'am.
organs
Yes,
and
ma'am.
limbs that we need. So when you say the vascular system, we've got our heart, but what else makes up that?
So going back to anatomy, the major vessel that gets out of the heart after the main heart pump itself is called the aorta. The aorta is a very large highway of blood that provides branches into every single part of our body. The first branches go up to the brain and to the arms. Then subsequently, every single organ has its own branch from the abdomen going down. Then it splits into two major highways called the iliac arteries that provide blood flow to the legs.
Mm-hmm. Well, that is I've always, I guess, when I thought about a heart doctor or a vascular doctor, you only think of the heart, but
That's
there's
right.
so much more to it than that.
That's right.
Yeah.
That's why it's a cardiovascular specialty now.
Right. So February's Heart Month. I guess talk to us about the most common types of heart disease and what those symptoms are.
We can divide this into three main categories to make it simple. Of course, a heart disease is very complex, but the first one that most people kind of relate to is blockages in the heart arteries. Basically, plaque buildup in the circulation of the heart muscle itself. That's the first type of heart condition. The second type of heart condition is not a plumbing problem, but an electrical problem,
Okay.
which is heart rhythm trouble, meaning one of the most dominant heart rhythm abnormalities is called AFib. It stands for atrial fibrillation, which means that the top chamber of the heart does not have a regular rhythm and starts kind of having a disorganized rhythm that leads the bottom chamber of the heart to beat irregularly, which can cause symptoms and can predispose patients for strokes. That's the second major category. The third major category is weakness of the heart muscle itself. We call that congestive heart failure. There are two major types, and those will lead to shortness of breath, accumulation of fluid in the lungs, swelling in the legs, and fatigue and decreased energy.
Mm-hmm. So can all of those trigger a heart attack?
A heart attack is mostly triggered by plaque buildup in the heart arteries. Of course, there are other possibilities like a clot going into the heart artery itself, but the large majority of heart attacks are related to plaque buildup that subsequently ruptures in the acute setting, and a clot forms on top of the plaque and blocks the vessel acutely.
So going to AFib, is that something that you're born with or you can contract? What
So
causes
the large
that?
majority of AFib is acquired rather than genetic. Of course, there is a small subset of genetic AFib that starts acting up in the 30s and 40s, but the large majority is related to enlargement of the top left chamber of the heart called left atrium, and that is related to high blood pressure, obesity, sleep apnea, and diabetes. Those are the major risk factors for it.
So can all three of those problems, I guess, come from maybe one thing is not taking care of ourselves?
That's right. That's why it's the most frequent. Unfortunately, a lot of heart risk factors go unnoticed without symptoms for years, and if a person is not following up with a doctor on regular basis, there's a tendency to catch this at the end stages of these conditions rather than prevention early on. And of course, preventing those is way more effective than actually treating them. We have very effective ways to treat them, but the goal is to prevent them rather than get to a point where the disease has caused damage.
So doctors talk to us a lot about blood pressure. People ask us, what's your blood pressure and stuff like that. Explain to me, I guess, what blood pressure is and how, when it's high, it can damage the heart.
That's right. So blood pressure is the amount of pressure exerted by the heart pump into the vascular system, meaning the amount of force that is generated by the heart pump into the blood vessels. How much, and it's measured by millimeters of mercury, which is a unit of pressure. And of course, it depends on how much blood flow is going and what's also the resistance of the circulation, meaning how much constricted the circulation is. So pressure is basically a unit of a physical unit that allows us to measure how much pressure is exerted by the heart pump into the blood vessels. And that obviously has a direct physical element to it. The higher the pressure, the more trauma the blood vessels are receiving, and the more damage and inflammation is happening in the blood vessels, and the more tendency for plaque formation, because plaque is partly related to the inflammatory process that recovers from this damage that the blood pressure exerts on the blood vessels.
Well, I myself have some bad genetics and have been on blood pressure medicine a long time. I've got that from my mother and my dad's side. What exactly does the blood pressure medicine do? Does it thin the blood, or how does that work?
So blood pressure medicines work in several different mechanisms. There are at least 7 or 8 kinds of mechanisms where the medicines would help. One of them is acting on some hormones secreted by the kidneys. They're called renin, angiotensin, and aldosterone. They block those hormones that have the tendency to constrict the blood vessels. Another mechanism is working on the heart pump itself by decreasing the amount of shear force that the heart pump is actually using to get the blood out of the heart into the vascular system. Another mechanism is called calcium channel blockers, which is a specific type of medicine that targets receptors on the blood vessels to relax the muscles that constrict those blood vessels. So the more relaxed these blood vessels are, the wider they are, the less pressure in the vascular system. These are one of the 3 mechanisms. Of course, I can go in detail through other mechanisms, but that's the most common.
Well, a lot of people are on blood pressure medicine and stuff, but there's different thoughts about medications and things like this, but that's something, it seems like, that is just, if you've got that condition, maybe that's step one into kind of preventing the heart from getting into stress in later years?
It's one of the major risk factors. In the plaque formation in the heart, there are 6 risk factors mostly. There are obviously more than that, but the most common ones are high blood pressure, which is what we're talking about, high cholesterol, obviously a condition that allows small cholesterol particles to deposit into the vessels themselves and form plaque and inflammation. Third one is smoking. Smoking is extremely damaging to the heart vessels. All the 7,000 chemicals in this smoke that go immediately into the bloodstream cause havoc into the vascular system. And diabetes is also a major one because some of the products of high blood sugar are extremely inflammatory to the blood vessels and lead to plaque formation. And of course, an overweight situation due to the sedentary lifestyle and genetics.
Okay, so all those things, and with us being in the South, we're that's a big problem
That's
here.
right.
We tend to not exercise as much. We love fried food. We love
Right.
sweets,
That's
so
right.
you got your work cut out for you, but we do too. There's a lot, I guess, we can do on our part to kind of change our lifestyle to help prevent ending up, I guess, seeing you. Now,
Absolutely.
if somebody has a procedure these days, I'm kind of blown away. Used to open heart surgery was kind of what you did, but many times, I guess now you all go through, you don't open the chest
That's
up
right.
to do procedures. Tell us how like stents and things like that
That's
work.
right. So we are blessed that the technology has become so minimally invasive that we can go through the wrist artery through a tiny little puncture, like an IV that you get at the hospital. It's slightly larger plastic tube into the vessel without an incision, and we pass wires and catheters through that IV up to the heart, through the blood vessels of the upper extremity. And then through that long catheter, we are able to inject dye into the heart vessels, and we are able to deliver equipment to be able to fix the plaque that's blocking the flow with balloons, something called atherectomy, which are multiple devices, like basically a spinning device that gets through the calcium. And then, of course, stents are metallic cylinders that are mounted on balloons that are made out of a mesh of cobalt and chromium mostly, that are deployed into the heart artery and get the plaque out of the way and allow blood flow to get back to the heart muscle. So the large majority of the time we can fix things minimally invasively through a small puncture in the wrist, and the recovery is about 3 to 4 hours. Patients can go home on the same day. Of course, there are some conditions where the plaque is so extensive that the best treatment is not multiple stents into the heart. It's bypass surgery, which has better long-term outcomes. And of course, we would have to take pictures of the heart arteries to make that decision, along with other testing that's done before the heart catheterization, like stress testing and CT scans.
So if you're, I guess, suspicious that maybe there could be, or you're just getting of the age, or it runs in your family, what's a person's first step to see if their plumbing is looking
That's
good,
right.
or do they schedule a stress test first?
Right. So basically, the first step is obviously for them to see their primary provider. Primary care providers are trained to know which patients have which risk factors and what kind of testing, blood work, and imaging studies are required to prevent and diagnose. So we have a set of guidelines, but there is a certain age at which the American College of Cardiology recommends what we call a calcium score, which is a fancy X-ray of the heart arteries. It takes 5 seconds. It's a very quick X-ray with very low radiation that allows us to see if there's calcium depositing on the heart vessels. That's not obviously for everybody, and your primary care provider would pick the right test for you. And stress testing is not for everybody. It's not a preventive test. It would be picked by your primary provider if you do have symptoms that are suggestive of heart disease. Now, what primary providers do is preventing heart disease from happening in the first place. So acting on all the risk factors that we had talked about by stopping smoking, making sure the blood pressure is within normal range, by making sure blood work is performed every 6 to 12 months to keep the cholesterol and triglycerides under control, to make sure that we're not diabetic, we're not overweight. All of these factors are the most important aspect of taking care of the disease. Now, when patients start developing symptoms, this is when we see them and the primary provider would refer them. But the goal is obviously to prevent that from happening in the first place.
Well, that's a good point. I never thought about that, is that your primary provider is trying to prevent all of these things from building up over the years and becoming irreversible.
Correct.
Which kind of brings me to my next question. Is heart disease reversible? Are there things that we can do, and does your heart kind of regain some of the strength that it had?
Yes. So about 20 to 30% of heart disease is genetically acquired. I see a lot of patients who kind of almost give up from the beginning. My family history is full of heart. I'm sure I'm going to have a heart condition. That's actually not true. Even if you do have genetics that predispose you for heart disease, almost 70 to 80% of it is preventable.
Wow.
With your lifestyle, your diet, and prevention with the risk factor control that we just talked about, you are able to take control of your health. Extremely rarely we have genetic conditions that are so aggressive that ravage the blood vessels of the heart early on in life, but this is the exception, not the rule. The large majority of patients that we see do have family history, but that you're not doomed if you have family history. You can take control of that. And your primary provider and cardiologist can help you from that perspective.
And that can be, as getting off the couch, taking a walk, walking the dog. You think about, I guess, that it has to be, running and stuff like that. I don't guess that's necessarily true.
Absolutely. Actually, in the last few years, we have a research that shows us that moderate activity is way healthier than extremely intense activity. People think like they have to run marathons to be heart healthy. That's not the situation. Walking briskly for half an hour a day, having a healthy lifestyle, always active, always going up the stairs instead of using the elevators, making sure we have dinner at a decent time, not too late, portion control, of course, not only the quantity of the diet, but also the quality of the diet. Having tons of green vegetables, green leafy vegetables in your diet is a prevention not only for heart disease, but cancer and all the chronic degenerative diseases you can think of, including dementia, joint problems, kidney problems, etc. So, and of course, trying to shy away from stress as much as possible, sleeping at a decent time, and obviously staying, having a good social life is also a great determinant of heart health.
That's, it is truly a full circle thing. And as I get older, you kind of realize you work on parts of it, but it really is, from the food you put in your mouth to social life and everything else.
That's
you
right.
know, how much you drink and all of smoking, all of that plays a part in it, I'm sure. So with the recent, I guess, cardiac arrest of Damar Hamlin, that was so polarizing, I guess, for those that are into sports, watch the ball game. How common are heart issues among athletes and our youth? Is that something that we need to be concerned about if we have children that, are working out to that extent?
It's not that common, fortunately. Obviously, once in a few years, we have a major event that happens out of just statistics. One athlete in thousands usually can be born with a genetic condition that predisposes for that. There are multiple different kinds of genetic problems that can affect the heart. Some of it is related to the heart muscle itself that becomes thicker and would have problems with scar tissue. Other problems include problems with the electrical system of the heart, where the heart goes into a very fast heart rhythm called ventricular tachycardia or fibrillation and kind of stops working and requires a shock. There are different kinds of structural problems with the heart valves people can be born with a valve that has less leaflets than it's supposed to, etc. So every single part of the heart can be predisposed for structural problems in its own genesis during, the fetal generation. But the large majority of athletes are super healthy people. So obviously we don't want to kind of be extremely anxious about that.
Mm-hmm.
But at the same time, there are some signs that coaches can pick up on, that of course teachers and can pick up on, that
Mm-hmm.
require an early evaluation. So massive screening with electrocardiograms of every single athlete is not recommended in the US yet. There are some parts of the world like Italy that do that, but our societies, professional societies, don't think it's appropriate right now.
Mm-hmm.
But of course there are certain things like someone fainting during a sporting event. That's a major symptom for us, and we would have to take it very seriously.
Okay. And I guess lots of, hydration and things like that
Mm-hmm.
need to be done to keep the athlete, hydrated and all their muscle parts working properly and,
That's
and
right.
that type of thing. So we've got a little bit of time. I'm going to ask you too about cardiomyopathy. That's something that I became aware of when my grandmother had it. How common is that? And is that, something I guess we think about a lot of people getting pacemakers? And is that something that is, I guess, pretty common? And what are some of the symptoms?
So cardiomyopathy, let's start with the definition first. Cardio means heart. Myopathy means disease of the heart muscle. So it's a disease of the heart muscle that becomes weak. That's the definition of cardiomyopathy. There are two different major types of cardiomyopathy. The first type is related to blockages in the heart vessels or coronary artery disease, and we call that ischemic cardiomyopathy. What that means is there's the blood flow to the heart muscle is lacking from all these blockages in the circulation. Mm-hmm. So the heart muscle kind of gives up. It does not want to function as much as it should be because it's not getting enough oxygen. Mm-hmm. So the heart muscle fails and the patient goes into congestive heart failure. That's the first type of cardiomyopathy. The second type of cardiomyopathy is non-ischemic, meaning it's not related to blockages of the circulation. The circulation of the heart is actually pretty good, but other factors are leading to that, including excessive alcohol. And alcohol in excess can literally kill the heart muscles. High blood pressure at a certain degree where the heart pump cannot generate enough force to fight that amount of resistance from the vascular system. There are certain types of chemotherapy agents, especially for breast cancer, that can affect the heart muscle. And of course, the cancer doctors are aware of that and monitor the heart very closely from the beginning if those medicines are life-saving, but at the same time they have those side effects. There are types of radiation therapy to the chest that can also damage the heart muscle if someone has esophageal cancer or breast cancer that requires radiation. That could be kind of a side effect from that. So these are the two different types of cardiomyopathy. And now when the heart muscle starts failing, we have pretty effective medications that allow the heart muscle to regenerate mm-hmm. and to get stronger again. Mm-hmm. And this requires long-term follow-up and obviously a specialist, adjusting the medications and looking at things very closely.
And that's encouraging to know that
Absolutely.
Things can be taken
Yes.
to rebuild
Yes.
that heart muscle again. So give us, I guess, some of the resources we have locally with River Park, and of course you practice a lot in Murfreesboro. We've got Ascension in Nashville too. But what are some of the resources we have here in McMinnville as far as our heart health goes?
So we do have obviously an office building here, and we've helped thousands of patients. It's been a very rewarding experience because the hospital support system and the community has been tremendous in allowing us to provide this prevention and treatments when patients need it. I really like the fact that I'm getting close to the patients rather than the patients traveling. It makes it convenient and, obviously allows us to deliver care in a much more effective way. The hospital here is amazing, the nursing care, the administration. So all of these, it doesn't only take a physician to take good care of a patient, it's a team. And that team is available here at River Park. I'm not familiar with other different parts of the area. This is where I practice mostly, along with Murfreesboro and Nashville. But I have been very impressed with the team helping me take care of the patient.
Well, it's good to know with Murfreesboro and Nashville growing like it has, and traffic is very difficult. You kind of worry about an older demographic having to travel for their medical care. But if you all are coming here to take care of the patients, that is super, that we don't have to make that trip unless it's just absolutely necessary.
And I personally enjoy the ride. That's kind of the
It's
highlight
pretty.
of my week.
Well, when the weather's good
Right.
and it's very pleasant. Well, thank you so much.
My pleasure.
Dr. Lichaa, I can't express enough how informative you have been for
Thank
us
you.
and lots to think about. And I'll thank our audience for joining us again for Table Talk. We'll hope you come back again next week, and we hope you enjoyed the show. Come back again for more Table Talk.